The American Diabetes Association brings you the very latest cutting-edge advances in diabetes research, prevention, and care. It's the 80th Scientific Sessions, a virtual experience, and we're ADA TV. Back now for more as the ADA 80th Scientific Sessions continue. We're coming up to Monday of the meeting, and there's still plenty more to get excited about here, wherever you're attending from. Coming up, we look at how diabetes doctors in Arkansas are providing optimal care for kids with diabetes. And we catch up with Dr. Robert Eckel to hear his priorities as president of Medicine and Science. First, though, we're back with Dr. Jose Florez to hear what he doesn't want you to miss on Monday.
Welcome back to day 4 of the American Diabetes Association Scientific Sessions. I hope you're enjoying the meeting. We're almost in the home stretch, but we have a full day ahead of you today. Very, very packed day of events at day 4. So one of the things that you don't want to miss is the number of symposia that have to do with type 1 diabetes today. We do have the TEDdy trial, so TEDdy looking at environmental and genetic determinants of progression to type 1 diabetes will present additional findings and update on what they've been doing today. There's also an account of various clinical trials that use automated insulin delivery systems, so closed loop, the use of insulin for people with type 1 diabetes, and that will also be happening. And then the SEARCH epidemiology study that has looked at diabetes in youth, type 1 and type 2 and monogenic forms will also give us an update. So packed set of sessions for type 1 or diabetes in youth. There is another great session on precision medicine in diabetes. And so this is the American Diabetes Association and the European Association for the Study of Diabetes that have come together with a precision diabetes initiative. And we will hear from the representatives of that group to see how the novel approaches that take many different sources of information to categorize the various forms of diabetes are used in the diagnosis and the treatment and the following of patients. And at the same time, we close the day with a year in review. This is a new feature that was introduced last year, where either clinical medicine experts or basic science experts or a translational expert will give us their account of what were the great discoveries and advances made in diabetes over the previous year. Those are all great. I would say don't miss, if there's one thing I want to emphasize, do not miss one session on disparities in diabetes in the context of recent events, both how the COVID pandemic has affected people of different groups differently, and in the context of what we see about disparities in our world and even racism in our world. I think having a session on disparities in diabetes is very pertinent, and I would say at 2:15, don't miss that symposium. We hope you enjoy the day, and we'll see you back tomorrow.
ADA TV is brought to you virtually from the 80th Scientific Sessions of the American Diabetes Association. Make sure to watch daily for highlights, interviews, and insights from around the world at the very cutting edge of diabetes research. Follow these links to see it all. Now to Arkansas, where physicians are working through the COVID-19 pandemic to provide excellent pediatric diabetes care, focusing on research to improve the lives of kids in Arkansas and beyond.
The diabetes program today looks like a much more robust program than it had been in the past. We're seeing more kids in the hospital as new patients to us, and we're seeing more patients flow through our education program and through our clinics.
This institution is very nimble and very effective at handling challenges and pivoting when something needs to be done a different way. I actually prefer doing research here where we can meet those challenges very, very quickly, and people are very adaptable.
Patients have been able to live their normal life. They are able to get the latest technologies in diabetes and able to, go about their life as if nothing much has happened.
They're always there for other people, and they make everybody feel very safe, and that's why they're a family to me.
I'm Bob Gabbay, and I am the new Chief Scientific and Medical Officer for the American Diabetes Association. I start July 1st, and I couldn't be more excited about the opportunity to lead an amazing organization that has an unprecedented impact on the lives of people with diabetes. My entire career has really been focused on the world of diabetes, from being a basic scientist and looking at insulin signaling mechanisms to becoming a physician and caring for people with diabetes. When the opportunity came to lead the ADA and its efforts in science and medicine, there literally is no greater opportunity for me personally to be able to have an impact. This crisis of COVID has been unprecedented in a lot of different ways. It's impacted all of us, and of course it's impacted the American Diabetes Association. And when I begin, I need to really reach out and understand your concerns, how the organization can serve our professionals more effectively, and continue our leadership role through the tremendous activities that we have always done. So we have more tools than ever, yet we've not improved care as much as we would have liked. And so we need more science and research to develop new treatments, to gain a better understanding of diabetes, whether that's the incredible work that's happening on basic mechanisms of insulin action, on the pathogenesis of type 1 diabetes and how we may be able to prevent that, from treatments for type 2 diabetes, and then ultimately, how do we take all of this that we know works and be able to spread it to all people with diabetes so we can really have an impact.
Remember, at the end of the meeting, you'll receive an email with instructions on how to claim continuing education credits. This year, you can claim 35 hours of credit for attending the virtual meeting and up to 328 credits for virtually attending sessions you missed. I have the great pleasure now of being joined by ADA President of Medicine and Science, Dr. Robert Eckel. We have so much to talk about, so let's begin with the big picture and the forecast for diabetes in the United States.
Well, diabetes is increasing in prevalence in the United States, and I think this raises a great concern in many, many ways. Not only for the people who live with diabetes, but ultimately the economic costs that relate to diabetes care.
You bring up the pandemic. What is the ADA doing to advance the science, to learn more? It's such an ever-changing situation.
Well, patients with diabetes who in fact get COVID-19 have a course that's much more complicated, including the need for hospitalization, assisted ventilation to breathe for them, and in addition, a higher likelihood of mortality. What the ADA has done is they've stepped forward with a series of webinars that inform the public as a whole and healthcare providers about how COVID-19 affects patients living with diabetes. But moreover, importantly, the ADA has just put forward a $1 million expenditure to fund grants that relate to diabetes and COVID-19 that will be funded over one-year intervals, and perhaps some 10 applications will be peer-reviewed and funded for that purpose.
We've spoken about the big picture. Now let's hone in on specific goals for the ADA in the next year.
I think the biggest goal for the ADA, like many other nonprofits out there, is to overcome the economic burden we're facing during this period of the pandemic. So I think this is incredibly important. The ADA needs your help, your service, and ultimately your money to continue the mission that we're facing. And remember, no money, no mission, no mission, no money.
Dr. Robert Eckel, ADA President of Medicine and Science, thank you so much. Wise words from Dr. Eckel, hoping to see big gains in diabetes research and care, even through a challenging 2020. That's it for us today. Make sure to watch everything you can here at the virtual meeting and come back to ADA TV tomorrow for a catch-up with President of Healthcare and Education, Dr. Mary DeGroot. See you then.